Why am I still in pain? So if you're still struggling with pain and you've tried stretching, painkillers, you even may have tried surgery and other conservative methods such as chiropractic, physiotherapy, and osteopathy, but you are still struggling, let me show you a couple of tips today to make sure we can get you feeling better and back to feeling mobile, active, and getting more exercise. My name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey. And I'm very excited to share with you a couple of secret tips that not many people will show you as to why you still maybe not 100%. It may be that you have had some relief and some success, but the problem is still coming back, especially when you're going back to doing tasks that you weren't normally doing, like exercising, bending over, picking up children, putting them in the bath. This can cause problems in the long run with your pain points, particularly the lower back pain, if you have any sort of instability. So one of the first reasons is you still may be in pain is that you haven't had the right diagnosis. So very often we see patients that have come from physiotherapists or chiropractors and not they've done a bad job at all, but sometimes they've got the diagnosis wrong or they haven't fully diagnosed the problem. So it's very important that you do have some sort of scan if you're still struggling with pain. We would always start with having a x-ray, and we can do those on site at both of our clinics. They're a very easy way to see if something has been missed or if there's more of a problem there. It's not necessarily that practitioners miss things, there's something else going on as well, or we fix the first thing and there's a secondary problem as well, which is still giving issues. So x-ray is a really good way to understand what's happening. If the x-ray doesn't show anything and you're still struggling with discomfort, then we would then recommend an MRI. An MRI is the gold standard for looking at any sort of disc issue in the base of the spine or in the neck, and it also allows us to see what's going on with the soft tissues, so the muscles, the ligaments, the tendons, the blood vessels, and see if there's anything else that we have missed in there, or if there could be anything more sinister that we are worried about as well. Now, MRIs are hard to come by. So on the NHS, the wait list for those can be as long as 6 months. Not typically, and if you get yourself on there, sometimes you can get a cancellation. I've seen it being done as quick as 2 weeks. If you're not willing to wait the month or 2 months that it usually is, then there is a place in Waterloo. They do one for £250. Now, that's not a small amount of money, but if you are really struggling, then that can be an option as well. So that is called Vista Health. So if you type in Vista Health Waterloo, you should be able to find out those as well. Now, that's only helpful if you live in the UK or close to London, but there are other places that you can go as well. So the correct diagnosis is vitally important. And I think a lot of the times when we have clients that come in here and we're struggling to find a long-term solution, it's always important to try and get other people involved. So whether that's the GP, that could be orthopedic surgeons, other chiropractors, physiotherapists. We like to outsource and see if there's anything else that we have missed. Sometimes when we get treating our patients, we have the blinkers on, and sometimes there's other stuff that we are missing. So it's very important to try and recruit extra help. So if you do find that you're getting extra help when you're going through some treatment plans with a physio or chiropractor, do not worry. It's always good to have two heads looking after you than one. The second reason why you still may be struggling or the pain is coming back is the fact that there are 3 components to pain. So we have physical pain or structural pain. So that is what most manual practitioners will do. Chiropractors, physiotherapists, osteopaths are looking to fix the structural issue. So if there's pressure on a nerve from a disc, the idea is to get pressure off the disc to allow the nerve to start functioning properly, get you out of pain and get you back to full mobility. So that would be a structural problem. Another structural issue would be a ligament sprain or a tendon sprain or a muscle sprain, where there's been an actual separation of some of the fibers or damage to the fibers, you have inflammation, pain. So structurally, we're trying to fix that problem, get the fibers to reform and heal and reduce that inflammation. So again, those are structural problems. Now, these do make up a large proportion of pain and injuries, but once that is fixed, some people still have pain. So why is that? Well, there's 2 other components to pain. We look at it like a triangle. So at the top, you have the structural, and on each side, you have chemical stress, and then you have emotional stress. So if we talk about chemical stress Chemical stress can be things like excess alcohol, smoking, toxins in the body, prolonged painkiller use, for example, or it can be an imbalance in vitamins and minerals. Now, this can be diagnosed from blood tests, and we can see exactly what is deficient. So I'll give you an example. If someone is deficient in magnesium or potassium, these are minerals that we need to help the muscles function properly, help the nerves function well. So very often, if the muscle is deficient in that vitamin or mineral, then it can cause pain or symptoms. So it may be structurally sound, there's a deficient vitamin or mineral, and we kind of need to look deeper into that. So blood tests are good. There is a chiropractic technique called applied kinesiology, which does a lot of muscle testing with vitamins and minerals and can be very effective when it's done well. The third one you have is your emotional stress. Now, I'm very wary that we have a lot of patients come in here and they're frustrated with a medical practitioner or a GP saying to them, it's all in your head. It's not all in your head, but there is an emotional component to some pains. So it's very important that when we're fixing the structural side, the chemical side, we do pay some attention to the emotional side. Because how many of you have had a long week at work, Monday to Friday, you get to the Friday and you think, oh, it's been very stressful, the kids are playing up, the neck starts to tense up, the shoulders start to tense up. That's the most common emotional form of pain that we see. Now, there's going to be a structural element to that because you would have been either sitting at a desk or lifting. There's going to be tension there anyway, but the emotional side of things does not help. And it puts stress in those areas. So how do we get rid of emotional pain? Well, one of the things that I love to do is Headspace. It's an app you can find on the iPhone, and it's a great way to just calm your mind, bring the stress levels down in your body, find a quiet 10 minutes in a day if you can, especially it's difficult around here, I know. If you can find 10 minutes, it's going to really bring that emotional level down, the symptoms down. That will help with that emotional side of things as well. But please, let me caveat this. I'm very aware it's not all in your head, but it's important to try and check off these things to help going forwards as well. And then number 3, it may be that you're starting to feel better, but when you're going back to doing exercise or lifting or sitting at your desk for long periods, that the problem keeps on coming back. So you feel good when you're not doing those things, but then it keeps on coming back in the long run. Well, that's no way to live. You need to be able to get out there, be active, mobile, playing with your family. So we can't wrap you in cotton wool for the rest of your life. So one of the reasons that the pain is coming back or the treatment is not holding in place is because of a lot of instability. So it's really important that you try and find that stability in your body using exercise and rehab. So 2 of the favorite things that I love doing, and I know when my back starts to play up when I've had a lot of stress or some physical problems, is because I'm not stable around my core and my glutes, and I can feel myself not engaging the areas when I'm moving around. So things that I love to do, the first one is I do Pilates. Now, you don't have to go to a class, you don't have to spend loads of money. There's loads of free online Pilates classes. So if you just type into YouTube, 20-minute free Pilates lower back class, you're going to get some great resources on there that you can do at home. Doing that 2 to 3 times a week is going to get that stability back. It's going to help the deep internal ligaments of your core hold onto your body, and it's going to give you that long-term resolution as you go through. Yoga, I like yoga as well. It's more of a stretching, and it's great again for that emotional side of things because it starts to bring the levels down of the stress, and it can have a very calming influence on your body. So I'm not against yoga, but there's some moves in there, particularly the Cobra when you're marching all the way back. If you're recovering from a structural back problem, I would probably just suggest not doing that and go to see a yoga class or watch a yoga YouTube video of someone that is proficient with looking after back pain. Okay, so there you have it. Hopefully that gives you some helpful tips to help get you out of that pain cycle and get you back to that 100%. If you like the video, please hit the like button. Please subscribe to the channel for our regular updates, and you can grab copies of my best-selling books here, The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and Transform Your Back, the second edition. Many thanks. See you soon.